Ever wondered how something as small as a bacterium can revolutionize women's health? In today's deep dive, we're exploring the mighty world of probiotics and their remarkable benefits for women. Groundbreaking studies have revealed that these microscopic powerhouses can prevent recurrent urinary tract infections, boost metabolic and cardiovascular health, and even aid in treating and preventing urogenital infections, including bacterial vaginosis and candidiasis. If you're curious about the science behind probiotics and how they can enhance your health, you've come to the perfect place. Get ready to be amazed by what these tiny bacteria can do. First off, what exactly are probiotics? Simply put, they're live microorganisms that, when consumed in adequate amounts, offer health benefits, especially for our gut. Now let's zoom in on why probiotics are particularly great for women. 1. Urinary health. Ladies, probiotics can be a game changer for preventing those pesky urinary tract infections by keeping harmful bacteria in check. 2. Vaginal health. They also maintain a healthy vaginal flora, reducing the risk of yeast infections. 3. Pregnancy and postpartum. Probiotics can significantly reduce the risk of complications during and after pregnancy, support mood regulation, and even promote healthy weight management. 4. Bone health. Bone density becomes a concern with age, especially post-menopause. Probiotics have been shown to help improve bone health, making them valuable ally. 5. Weight management. Promising research suggests that certain probiotic strains can help with weight loss and reduce belly fat. Who knew these tiny bacteria could be so powerful? In the study titled Probiotics for Prevention of Recurrent Urinary Tract Infections in Women, authored by M. Falagas, G.I. Betsy, T. Tokas, and S. Athanasiou, a significant focus is placed on the potential of probiotics, especially Lactobacillus rhamnosus GR1 and L. reuteri RC14, in preventing recurrent urinary tract infections, UTIs, in women. The key takeaway from this research is the effectiveness and safety of Lactobacillus rhamnosus GR1 and L. reuteri RC14 in preventing recurrent UTIs. These strains, among others studied, have shown encouraging results in restoring the urogenital flora dominated by uropathogens with lactobacilli, which is crucial for healthy premenopausal women. While L. cassis shirota and L. crispatus CTV05 have also demonstrated efficacy in some studies, L. rhamnosus GG was not found to be as effective. The evidence suggests that probiotics, particularly these specific lactobacilli strains, can offer a beneficial approach to preventing recurrent UTIs in women and have a good safety profile. However, the authors note the need for further research to solidify these findings before recommending widespread use of probiotics for this purpose. A study titled Impact of Probiotics in Women with Gestational Diabetes, Mellitus on Metabolic Health, a randomized controlled trial conducted by K. Lindsay, L. Brennan, M. Kennelly, and others, offers insightful findings on the effects of probiotics on women's health, particularly those with gestational diabetes. Key takeaways from the study. 1. The intervention with probiotic capsules, specifically Lactobacillus salivarius UCC118, showed no significant impact on glycemic control in women diagnosed with gestational diabetes or impaired glucose tolerance. 2. This suggests that probiotics may not directly influence blood sugar levels in pregnant women with abnormal glucose tolerance. 3. Interestingly, the study found that probiotic treatment attenuated the normal pregnancy-induced rise in total and LDL, low-density lipoprotein, cholesterol. This effect indicates a potential role for probiotics in managing cholesterol levels during pregnancy, which could have implications for cardiovascular health in pregnant women, especially those at risk of gestational diabetes. This highlights the specificity of probiotics' effects on cholesterol without broader impacts on gestational diabetes, management, or pregnancy outcomes. In the comprehensive study titled Probiotics for Treatment and Prevention of Urogenital Infections in Women, a systematic review authored by L. Hansen, L. Vandervoos, Martha G. Jamay, C. Abad, and N. Safdar, the effectiveness of probiotics in combating urogenital infections in women is thoroughly examined. 1. Scope of review. The review analyzed studies from January 1, 2008 through June 30, 2015 focusing on the efficacy of probiotics in treating and preventing urogenital infections in adult women. 2. Results. The findings were promising, showing that probiotic interventions were effective in treating and preventing bacterial vaginosis, preventing recurrences of candidiasis and urinary tract infections, and clearing HPV lesions. The studies varied in design, intervention, and outcomes, with 4 studies rated as good quality, 9 as fair, and 7 as poor. Another study titled Multi-Species Probiotic Supplementation favorably affects vascular function and reduces arterial stiffness in obese postmenopausal women, a 12-week placebo-controlled and randomized clinical study, authored by M. Szulinska, I. Woniewski, K. Skripnik, M. Sobieska, K. Korybalska, J. Soliburska, and P. Bogdański. A significant discovery was made regarding the health benefits of probiotics for women. Published on the Consensus platform, this research highlights how obesity in postmenopausal women, which increases the risk of cardiovascular diseases, can be positively impacted by probiotic supplementation. The study evaluated the effects of 2 doses of the multi-species probiotic ecologic barrier on both functional and biochemical markers of vascular dysfunction in obese postmenopausal women over 12 weeks. It was a randomized, placebo-controlled clinical trial involving 81 obese Caucasian women. Findings revealed that high-dose probiotic supplementation significantly decreased systolic blood pressure, vascular endothelial growth factor, pulse wave analysis, systolic pressure, pulse wave analysis, pulse pressure, pulse wave analysis, augmentation index, pulse wave velocity, interleukin-6, tumor necrosis factor alpha, and thrombomodulin. Even low doses of probiotic supplementation were found to decrease systolic blood pressure and interleukin-6 levels. These changes indicate a favorable modification in both functional and biochemical markers of vascular dysfunction in obese postmenopausal women, showcasing the potential of probiotics in enhancing cardiovascular health and reducing arterial stiffness. In the study titled Effects of Probiotic Therapy on Cardiometabolic Parameters and Autonomic Modulation in Hypertensive Women, a randomized, triple-blind, placebo-controlled trial led by Larissa de Fatima Ramau da Silva and her team, including Ia de Oliveira, E.L. de Souza, and others, a significant discovery was made regarding the impact of probiotics on women's health. Conducted on 40 hypertensive women aged 20-50, this research found that an 8-week course of probiotic therapy could lead to notable health improvements. The participants were divided into 2 groups, with one receiving a daily sachet of a probiotic blend containing Lactobacillus paracasei LPC 37, Lactobacillus rhamnosus HN01, Lactobacillus acidophilus NCFM, and Bifidobacterium lactis HNO19, and the other receiving a placebo. The results were compelling. The probiotic group saw a significant reduction in fasting glucose levels and improved lipid profile, including a decrease in cholesterol levels and an increase in HDL cholesterol. Moreover, the study highlighted an improvement in autonomic modulation among the probiotic group, evidenced by reduced low-frequency oscillation and LF high-frequency ratio in heart rate variability. This indicates a positive shift in autonomic nervous system balance, which could have broader implications for cardiovascular health and stress management. This groundbreaking research by Silva and her colleagues, published in publication year not provided, underscores the potential of probiotics as a therapeutic tool for women with hypertension, offering insights into non-pharmacological interventions for improving cardiometabolic health and autonomic function. A study conducted by Louise Crovesi, T. L. Bacha, and E. L. Rosado, titled Modulation of the Gut Microbiota by Probiotics and Symbiotics, is associated with changes in serum metabolite profile related to a decrease in inflammation and overall benefits to metabolic health. A double-blind, randomized controlled clinical trial in women with obesity, a significant focus was placed on the impact of probiotics and symbiotics on women's health, particularly in the context of obesity. Published on the Consensus platform, this research highlights the potential of probiotics and symbiotics to improve metabolic health and decrease inflammation in obese women. The study's key takeaway is that both probiotics and symbiotics can lead to metabolite changes associated with improved metabolic health. The study found that all groups showed a decrease in glycerol and an increase in arginine, glutamine, and 2-oxoisovalerate, indicating that a low-energy diet alone could promote changes in the metabolite profile related to decreased inflammation and positive effects on body weight. However, the symbiotic group presented unique metabolite changes, suggesting some advantage in combining Bifidobacterium lactis with fructooligosaccharide as part of a low-energy diet, rather than using probiotics or diet alone. This research underscores the potential of targeted probiotic and symbiotic interventions in improving metabolic health in obese women, offering a promising avenue for future studies and applications in nutritional science and obesity treatment. Another study titled "The Roles of Probiotics in the Gut Microbiota Composition and Metabolic Outcomes in Asymptomatic Post-Gestational Diabetes. Women, a Randomized Controlled Trial," authored by Z. Hussain, R. Raja Ali, H. F. Ahmad, and published in the journal Nutrients, significant findings were presented regarding the impact of probiotics on women's health, particularly those who have experienced gestational diabetes, mellitus, post-GDM. It aimed to investigate the effects of probiotics on gut microbiota composition and metabolic and inflammatory outcomes. Participants in the intervention group received a cocktail of 6 probiotic strains from Bifidobacterium and Lactobacillus for 12 weeks, while the placebo group received an identical sachet devoid of living microorganisms. Key findings from the study include: 1. There was a significant decrease in fasting blood glucose levels in the probiotics group, with a mean difference of 0.20 mol p-Zo 21. 2. There were notable differences in HbA1c, total cholesterol, triglycerides, and high-sensitivity C-reactive protein levels between the probiotics and placebo groups, all favoring the former. 3. A significant increase in Bifidobacterium adolescentes in the gut microbiota following probiotic supplementation. These results underscore the potential of multi-strain probiotics to improve metabolic and inflammatory outcomes in post-GDM women by modulating gut dysbiosis. The study highlights the importance of incorporating probiotics into a comprehensive postpartum treatment strategy to protect post-GDM women from developing glucose intolerance. This study adds to the growing body of evidence supporting the health benefits of probiotics for women. It emphasizes the need for targeted probiotic interventions in postpartum care, particularly for those at risk of metabolic disorders. 1. Study by Hussain, Z, Ali, R, Ahmad, H, Raouf, U, Un, S, and Mokhtar, N, 2022 in Nutrients. 2. This study focused on the effects of probiotics on women who had gestational diabetes, mellitus, GDM. 2. The study highlights the potential of probiotics in improving metabolic and inflammatory outcomes by modulating gut dysbiosis in post-GDM women. Probiotics in clinical practice for urogenital infections. 2. Study by Reedy Al-Reed and colleagues explored the potential uses of probiotics in clinical practice, emphasizing their role in improving intestinal infections and reducing the recurrence of urogenital infections in women. 3. The study suggests that probiotics can offer benefits beyond gut health, including managing urogenital infections such as bacterial vaginosis and candidiasis. Probiotics' potential to prevent HIV and STIs in women. Erstens, study by Bolton, A. van der Straten, C. Cohen. 2. Bolton and team reviewed the potential of probiotics as a cost-effective, female-initiated method to prevent HIV and sexually transmitted infections, STIs, in women. 2. The study suggests that probiotics could act both indirectly by treating and preventing recurrent bacterial vaginosis, and directly by secreting substances that block HIV and STI transmission. 2. This promising avenue of research highlights the need for more fundamental studies to optimize probiotic formulations and their application in preventing sexually transmitted diseases. While probiotics are generally safe, it's important to use them wisely. In rare cases, they can cause side effects like bloating or gas. especially when you first start taking them. If you have a specific health condition or are pregnant, it's best to consult with a healthcare provider before starting any new supplement. From preventing recurrent urinary tract infections to enhancing metabolic and cardiovascular health, and even offering new avenues for treating and preventing urogenital infections like bacterial vaginosis and candidiasis, probiotics stand at the forefront of a health revolution tailored for women. The studies we've delved into underscore a promising consensus. Probiotics are key to unlocking many health benefits specifically for women. Whether it's combating post-gestational diabetes, managing weight, or even potentially safeguarding against HIV and STIs, the evidence is compelling. Probiotics support our gut health and play a critical role in maintaining and enhancing women's health across various stages of life. Incorporating probiotics into your diet through fermented foods or supplements could be a simple yet powerful step towards better health. Thanks for tuning in, and see you in the next video.